Streamlining workflows, cutting costs, improving diagnostic accuracy, and enhancing patient outcomes are just a few of the challenges optometrists face today. Join us as we sit down with Dr. Jeffry Gerson to explore practical strategies for empowering optometrists in their practices.
My name is Jeff Gerson, and I'm an optometrist in Kansas City. I would tell you that I first became really interested in pathology like diabetes and macular degeneration when I first did my residency, and it's kind of become a passion to continue to see and follow those patients.
So let's just start off. What features of the Aurora AEYE handheld fundus camera convinced you to use it in diabetic retinopathy screening?
Yeah, so I would tell you there's a number of different features. I think the first one is just the simplicity. It's something that's just really easy to be able to use. What impresses me is it doesn't have to be me using it. It can be anyone in my office. It could be a staff member that we can train pretty quickly and pretty easily. And so for me, that's something that's really attractive. And then the results. To be able to have instant results with something like this is it's just amazing to be able to have in clinical practice. And I think the other thing as far as logistics of use is having something that is handheld and portable, so that you can move it around the office, you can take it to different places if you want. I think as a screening for diabetic retinopathy, obviously using the cloud-based AI is a really important feature that can be used even in intermediary exams. So not just at an annual exam, but having a 6-month follow-up and making sure we're following our patients a little bit more closely. Because it's handheld and portable, and because of the AI, I think there's so many different ways that it can be used, whether you're using it within the 4 walls of your practice as a traditional fundus camera, because it does a great job of that, and even looking at the images through the portal, whether it's using it in your office as a screening tool, for comprehensive exams, whether it is for bringing patients back at different intervals, maybe in 6 months for an additional AI-generated screening, or even using outside the walls of your practice. So I think the potential with outreach and mobile clinics is something that most of us probably haven't explored, because traditionally most of the instruments we use they sit on a table, they're not mobile. So having something that's handheld and mobile creates that opportunity, going places like a nursing home, going to community health screenings, where it's so important to be able to provide this type of screening using the AI in this. So I think it opens up limitless doors.
Fantastic. So how can a device like the Aurora AEYE be integrated into clinic workflow and billing in a way that supports routine exams, so like annual checkups, without causing disruptions or significantly increasing costs?
Yeah, so I think the workflow issue is almost a non-issue. When you have something that is a handheld instrument that you can take from room to room and you're not tied to one specific place, I think that makes it a lot easier as far as general workflow and to be able to use it with routine exams. I think as far as the billing, because we have different codes that we can use with this instrument, whether it's for traditional fundus photography or AI-assisted screenings for diabetic retinopathy, I think it creates multiple different opportunities for using it as far as the billing and the economics of your practice.
Right, it's just providing more opportunities instead of other typical devices.
Yeah, absolutely.
Okay, so in the clinical practice today, AI and technology are seen in 2 different lights. Some view them as potential replacements for practitioners, while others believe they serve to augment and enhance a practitioner's work. So what are your thoughts on the role of AI and technology in patient care?
Yeah, so I think first and foremost is that AI is here. It's not going away, and it's going to become a more prominent part in healthcare along with everything else. I think what scares people is that, will AI replace me? And I think at least for the near future, as far as we can tell, the answer is an absolute no. Because as amazing as this is for what it does, no AI program is perfect, even with the over 90% sensitivity and specificity. Still not perfect. So there's still a need for comprehensive eye care and eye doctors. This takes into account one part of that eye exam. It makes you much more efficient and effective in that part of your eye exam. Right now, AI is just barely scratching the surface. Just having a brand new FDA approval for this, it's just scratching the surface for AI in eye care. And I'm glad it's with diabetic retinopathy because of the public health concerns that diabetes and diabetic retinopathy creates. But I think what we need to realize is it may not be very long until we're using artificial intelligence in many aspects of our practice. And so I think it's something that we need to embrace and allow and encourage AI to help us be more effective practitioners.
Could you share a case where AI or technology-assisted analysis led you to make a more informed decision?
I think I might take that in a slightly different direction. Instead of how it informed my decision, I think how it helps instill confidence in my patients. So one of the ways that I'm using this currently is when I go into the exam room and either I take or someone else has already taken the image. And what I tell the patient is we're going to use artificial intelligence to make sure that the exam I do and the diagnosis I come up with is the same. And especially knowing that this has over 90% sensitivity and 90% specificity, I think it helps instill greater confidence in my patients. The other thing it's doing is it's laying down the groundwork to be able to use this in different capacities with these same patients in the future. I've already instilled the confidence that it works, it gives the same answer as me, and so this is something that we can be using in the future.
What is the key takeaway for optometrists contemplating the integration of the Aurora AI into their practice?
I think the key takeaway for the Aurora AI is, number one, its availability. I think a lot of people don't know that there is something available that uses cloud-based artificial intelligence to recognize whether patients have more than mild non-proliferative diabetic retinopathy. So number one is just the awareness. And number two is I would tell people to really look at how you practice. And when you really look at that, it won't be hard to see how this can be integrated into what you do within the four walls of your practice, outside the four walls of your practice, or in integrating with other healthcare professionals.
Okay, fantastic. Thank you so much.
Thank you.
Awesome. Explore how technology can elevate your optometry practice with the Aurora AI. Discover ways to enhance efficiency, accuracy, and patient care with this powerful tool. Visit the Optomed website to learn more and see how Aurora AI can make a difference in your clinic.